Hi, if you're planning to get a tooth removed or already have got a tooth removed, then this video is for you because we are going to explain four options you have after removal of tooth. The second thing we are going to explain towards the end of the video are the five factors you need to consider while selecting one of the four options. I'm Dr. Satish Kumar. This is SK Smile Dental. Our aim here is to help you smile. Option number one, don't do anything, just leave it as it is. But the problem with this option is, if it is tooth from the front, you will look extremely ugly, and if it is a tooth behind, you will have difficulty in chewing. Other than this, remember the tooth has two functions. One, it helps us in chewing, and second, it holds its position. So soon as you remove a tooth, the other teeth from the side would drift into that area, and the tooth from the opposite jaw will also start pushing into it. This can lead to a lot of food lodgement in all those spaces which are created because of this movement. That can cause decay, and eventually those teeth would also go bad. So this option is usually not advised. The one place where this option is advised by dentists is when it is your wisdom tooth. Wisdom teeth need not be replaced, and we have explained this in detail whether you should get your wisdom tooth removed or not in the video out here. So please go and check that out if you are concerned about your wisdom tooth. In all other cases, option number one, that is leaving it as it is a pretty bad option. Option number two is replacing it with a denture. A denture is basically a removable plastic appliance which is also available nowadays with a metal backing or a metal base. Now, depending upon whether you're missing a few teeth or a complete set of teeth of either the upper or lower jaw, the denture is known as removable partial denture, that is half set of teeth, or complete denture, that is when you're missing your entire set of teeth. Now, the advantage of this procedure is it is extremely quick, there is no surgery involved, and it is pain free. The other part is it is very cost efficient. But the major disadvantage is it is removable. At the end of the day, you have to remove it and keep it in the water. If you're wearing it for a long duration of time, you tend to lose the bone grip below the denture as it applies pressure onto the bone. As the bone tends to resorb, the denture would become loose. And every 3 to 4 years, you might have to replace it. Eventually, the bony structure is so weak that even if you get a brand new denture made, it would be loose, and when you're speaking or talking, it might pop out. It is not as comfortable as fixed options as well. So the removable denture, though might be little good on the pocket, is not very comfortable and not fixed. The third option is a bridge. If you want to go from one place to another, you take support on either side and build a connection in between. Similarly, to replace the missing tooth, you take support from the adjacent teeth. But in this case, if you're taking support from the adjacent teeth, you have to put crowns on both of them as well. For doing that, you will have to reduce some amount of tooth structure because the crowns require a minimum amount of thickness so that they do not fracture and survive for a long duration. The advantage of this procedure is it is a fixed option, but the disadvantage is you would be sacrificing the tooth in front and behind by removing good amount of a structure known as enamel which cannot be regenerated. The disadvantage further goes on that if the enamel is very thin and when you do cutting of the teeth, it might expose the nerve ending below. Maybe you might end up requiring a root canal procedure. So if you want to prevent damage for the adjacent teeth, then a fixed bridge is not a very great option. But if you're ready to sacrifice them and you want a fixed option, then you can try for a bridge as well. If you're liking this video, before you listen to the fourth option, please do not forget to hit the bell icon below. And I'm sure if you're concerned about your teeth and want to replace your teeth and want to know more options about it, then this is a channel you need to subscribe to. The fourth and the currently best option in most cases is dental implant. In dental implant, we place a titanium alloy within the bone, which fuses with the bone over a given period of time. It might be 3 months or 6 months, depending on the quality of bone you have. Once it fuses, there is a connection known as an abutment which is placed over the implant and a cap comes over it. Yes, a single tooth missing would require a single implant. But what if you're missing three teeth? You usually need not go in for three implants unless the bone support is very less. In most cases, two implants and an implant supported bridge is more than adequate. What if you're missing the entire set of teeth in a given jaw? 4 to 8 implants is enough to give you adequate fixed teeth. Now, depending upon your case, the dentist would suggest you how many implants you need to go in for. So feel free to contact us if you're thinking about dental implants. Are there cases where you cannot do dental implants? In 95% of the cases, dental implants are possible. Yes, there are certain situations like if you are on bisphosphonate therapy, you have uncontrolled diabetes currently, or are smoking and are not planning to quit. In most other cases, dental implants is possible. The advantages of dental implants include it is a fixed teeth. Second, they usually look lifelike. Third, it is extremely comfortable and you can chew as you chew with your regular teeth as well. They also have a high success rate of more than 90%. That is, out of 100 implants placed, more than 90% of implants tend to survive more than 10 to 15 years. Now, the 5 things you need to consider while selecting your treatment option. Point number 1, the finances included. Yes, there are certain procedures like dental implants which might be slightly more expensive as compared to doing nothing or going in for dentures. But over a long run, the implants tend to be more cost efficient because you do not have to get them changed frequently and they end up saving a lot of bone structure so you can have permanent teeth for a longer duration of time. The second factor you need to consider is the advantage or disadvantages to the adjacent teeth. For example, while placing a dental implant, you would not be touching the adjacent teeth. But when you're going in for bridges, you will have to use them as supports. Your dentures might have certain hooks which might go and grab on to the adjacent teeth, which may later cause damage to them. The third factor you need to consider is habits and health. If you have habits such as smoking, which you do not plan to quit, then dental implants is a tough option. If you have uncontrolled diabetes, you first have to get your diabetes under control, then only you can go for surgical procedures which are required in dental implants. If you are on bisphosphonate therapy, you have to see when you will be able to stop them and for after how many months you can go for procedures like dental implants. So knowing your health and habits is also an important consideration while selecting the treatment option. The fourth point you need to consider is time. How fast the procedure can be completed, whether you want temporary teeth in between procedures because it's your friend tooth which maybe you might be missing. So what are the options you have in that case? Those are the factors you need to consider. In case of time, one other important thing which you need to keep in mind is how long the treatment would usually last. The fifth and the most important point you should keep in mind is comfort. Whether the treatment option is a fixed option in the long run, whether it will look natural, whether you will feel good when you have it in your mouth, or is it slightly cumbersome where you will have to remove it every night and keep it aside. So looking at comfort is one of the most important criteria you need to keep in mind. If you have any other questions, feel free to post them in the comment section below. We'll try and answer each one of them. I'm Dr. Satish Kumar. This is SK Smile. Our aim here is to help you smile.